Hello, welcome to Chatting with Chitness. I'm Dr. Salil Chitness. I'm a pediatric emergency medicine physician, and we're going to be talking about pediatric medical education. We got a very exciting video, so let's get chatting. Today is a really big topic, probably one of the most common things I see in the emergency room, probably one of the scariest things that parents see, and it's going to be about febrile seizures. So let's just jump to it. So what is a febrile seizure? So a febrile seizure is a seizure that happens when your kid has a fever. Also, they could have just had a fever in the last 24 hours. That still counts as a febrile seizure. And it has to happen usually between 6 months to 6 years old. So causes. So what causes a febrile seizure? So the most common cause is a virus called HHV6. It causes roseola. But any fever can cause a febrile seizure. And it's actually not how high your kid's fever is. It's the fact that they go from no fever to fever too quick. Our own brain sets the temp and makes the fever. So it's kind of like the brain goes a little too quick for itself and kind of, shorts out and causes the seizure. So how do we treat a febrile seizure? So we don't really treat it if the seizure stops on its own and your kid is back to their normal self. We basically just forget about the seizure. I know that sounds terrible, but we really look at why they have a fever. And most likely it's an infection, most likely viral, but we look for ear infections, throat infections, any kind of infection that we could treat. The mainstay for treating your kid's fever is ibuprofen and Tylenol. We have a great video on how to dose it. I'll put a link up above and a link in the description. You want to do supportive care with just a lot of fluids and rest. And that's about it for the treatment. So when do we worry about a febrile seizure? So as I mentioned earlier in the video, they usually happen between 6 months to 6 years. So if your kid has a febrile seizure outside of those age groups, so under 6 months or older than 6 years, then that's worrisome. If the seizure lasts more than 15 minutes, that's also worrisome. What is kind of counterintuitive, but if only one side of their body is shaking and not the whole body, that's actually worse. We want the whole body to shake. It's a better outcome. And then how many febrile seizures do they have? So if they have more than 2 in 24 hours, that also makes us worried. So what does that mean that makes us worried? It doesn't really change what we do, but it really means that your kid needs to see a pediatric neurologist. If they just have a simple febrile seizure, they don't need to see a neurologist. But when it starts getting all those things I mentioned to be worried about, it turns into a complex febrile seizure and they really need to see a neurologist. Let's do a quick recap on febrile seizures. They look a lot scarier than they are. They actually are pretty safe. They happen when your kid has a fever. It's most likely viral. We don't really treat the seizure unless it's a complex febrile seizure and it's not stopping on its own. And we worry when your kid doesn't come back to their normal self after the seizure is over. You want to treat their fever. The seizure doesn't happen from how high the fever gets, but it happens because they go from no fever to fever. So parents out there, they're very scary looking. I've seen a lot, but they don't do any brain damage and your kid is going to be okay. Please leave any comments down below on what you want to chat about next time on Chatting with Chitness.